I'm Dr. Jeanelle de Gruchy and I'm Director of Public Health for Tameside, and I want to give you an update on where we are with COVID in Tameside. Our rates of COVID are now reducing, which is really good news, but they're only reducing quite slowly and the rate is still quite high. It's around 100 per 100,000, which means we're up in about the top 20 local authority areas in the country, so really quite high. What this means is that as we ease some of the lockdown restrictions, for instance, the schools going back, we could see our rates go up again quite quickly. And that's a real concern because for two reasons. Firstly, although we've vaccinated over 70,000 people, which is fantastic, a great achievement, and we hope to continue to vaccinate many more. But until we do, there's still many people who are vulnerable to falling really ill and possibly dying from COVID. So we can't afford for the rates to go up and for more people to fall ill. Also, secondly, high rates of COVID are a problem because they give the virus a much greater chance to mutate into a variant, and it may be a mutation or a variant that may not respond to the vaccine or to our other control measures, or might be even more transmissible. So it's really, really important that we do all that we can to stop the infection spreading. So I'm asking everyone to not take their foot off the pedal. We need to keep going for a while longer and follow hands, face, space and the other rules that we have in place to stop the spread of COVID. On schools, it's fantastic that schools are reopening from Monday, the 8th of March. Really important for our children's well-being and for their education. And that's the reason why it's one of the first things that we are looking to open as we come out of lockdown. Now, a lot of people have been working to ensure that safety measures are in place, including rapid testing, face coverings in secondary school classrooms, and other ways in which we're making sure that the school is a safer place for both the students and the staff who work there. The rapid testing for schools will help limit transmission because we'll know much more quickly if someone is infected. And so it will help us prevent outbreaks. And anyone who has the infection should be detected much more quickly and asked to self-isolate. Parents and carers are urged to ensure that their children don't mingle outside of school. We ask you please not to gather at school gates and to remember social distancing at all times. It really is still about hands, face, space. We know that the scientific evidence shows that transmission in our schools is low and that often it's not actually the school where we find the transmission, but it's in the wider community. So it really is so important that we don't mix with other households, other families, and that we follow the restrictions outside the school gates so that all of us can do our bit to ensure that our schools can stay open and children can attend without further disruption. Thanks again for all that you're doing to follow the rules and help keep everyone safe and ensure that our children can start going back to school.